ASCP Phlebotomy Exam Study Guide. Question 1. Which of the following options describes a pre-analytical error that can occur in phlebotomy? Option A. Miscalibrating an automated glucose analyzer machine. Option B. Misidentifying a patient or mislabeling a specimen collection tube at the bedside. Option C. Delaying the entry of finalized lab results into the electronic medical record. Option D. Misinterpreting a cellular structure under a microscope. The correct answer is option B. Misidentifying a patient or mislabeling a specimen collection tube at the bedside. Misidentifying a patient or mislabeling a tube occurs before the sample is analyzed, making it a pre-analytical error. These errors are especially dangerous because the laboratory may produce a technically valid result on the wrong specimen. Analyzer calibration and final reporting occur in later phases. Question 2. Hemoconcentration can be caused by which of the following actions? Option A. Leaving the tourniquet on for longer than 1 minute. Option B. Using a needle that is too small for the vein. Option C. Inverting the collection tubes too slowly. Option D. Puncturing the skin before the alcohol is dry. The correct answer is option A. Leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 3. When performing a newborn screening, PKU, collection card, how must the blood be applied to the filter paper? Option A. Layered drop upon drop until the circle is saturated. Option B. Applied to both sides of the paper simultaneously. Option C. Brought into direct contact with a single large drop to fill the circle completely. Option D. Smeared across the surface using a plastic capillary tube. The correct answer is option C. Brought into direct contact with a single large drop to fill the circle completely. Newborn screening filter paper should be filled by touching the paper to a large hanging drop of blood until the circle saturates. The blood should soak through evenly from one side without layering multiple drops. Smearing, scraping, or applying blood to both sides can invalidate the specimen. Question 4. If a phlebotomist notices that a patient's name on an ID band matches the requisition, but the medical record numbers are different, what should they do? Option A. Draw the specimen and cross out the number on the tube label. Option B. Proceed with the draw as long as the alphabetical spelling of the name is correct. Option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Option D. Ask the patient which number is the correct one to use. The correct answer is option C. Do not collect the specimen until the discrepancy is resolved by admissions or nursing staff. Matching names are not enough when medical record numbers conflict. The specimen must not be collected until the discrepancy is resolved by appropriate staff. Asking the patient to choose a number or editing labels manually can create a serious identification error. Question 5. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A. Informed consent. Option B. Expressed consent. Option C. Implied consent. Option D. Statutory consent. The correct answer is option C. Implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 6. What does the term phlebotomy literally mean in Greek? Option A. To clear a blood clot. Option B. To measure blood cells. Option C. To cut into a vein. Option D. To study circulating fluids. The correct answer is option C. To cut into a vein. The word phlebotomy comes from roots meaning to cut into a vein. The term reflects the traditional act of opening a vein to obtain blood. Measuring cells, studying fluids, or removing clots describes different laboratory or clinical activities. Question 7. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A, 70% isopropyl alcohol alone. Option B, chlorhexidine gluconate or tincture of iodine. Option C, sterile saline solution. Option D, benzalkonium chloride. The correct answer is option B, chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 8. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during a draw? Option A, use the partial sample anyway and send it to the lab. Option B, discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C, pour blood from a green top tube into the light blue tube to top it off. Option D, shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 9. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B, releasing the tourniquet as soon as the first tube begins to fill with blood. Option C, utilizing a needle with a large lumen, such as a 21-gauge needle. Option D, having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 10. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A, hematoma. Option B, hemolysis. Option C, petechiae. Option D, ichthyosis. The correct answer is option C, petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 11. For which of the following tests must the specimen be protected from light immediately after collection? Option A, ammonia. Option B, bilirubin. Option C, lactic acid. Option D, prothrombin. The correct answer is option B, bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 12. What type of vessel contains valves to prevent the backflow of blood as it travels back toward the heart? Option A, artery. Option B, capillary. Option C, vein. Option D, arteriole. The correct answer is option C, vein. Veins contain valves that help prevent backflow as blood returns to the heart at low pressure. These valves support venous return, especially from the limbs. Arteries carry blood under higher pressure and usually do not need valves along their length. Question 13. What is the proper clinical intervention if a hematoma forms rapidly under the skin while you are drawing a patient's blood? Option A, press down hard on the needle to flatten out the swelling. Option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Option C, switch to a larger vacuum tube to pull the pooled blood out of the tissue. Option D, continue the draw until all ordered tubes are filled completely. The correct answer is option B, release the tourniquet immediately, pull the needle out, and apply firm pressure to the site. Rapid hematoma formation means blood is escaping into tissue during the draw. The tourniquet should be released, the needle removed, and firm pressure applied to stop the bleeding. Continuing the collection or trying to drain the swelling through the tube can worsen injury. Question 14. How many times should a light blue top tube be inverted immediately after collection? Option F 1 to 2 times. Option B 3 to 4 times. Option C 5 to 8 times. Option D 10 to 12 times. The correct answer is option B 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 15. Chain of custody protocols are required for which type of laboratory specimens? Option F routine lipid panels. Option B therapeutic drug monitoring. Option C paternity and forensic drug testing. Option D blood cultures for sepsis. The correct answer is option C paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 16. Which of the following items must be included on a computer-generated barcode specimen label? Option A. The patient's diagnosis and name of their insurance carrier. Option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. Option C. The phone number of the patient's next of kin. Option D. The laboratory technician's home address. The correct answer is option B. Unique patient identifiers, date, time of collection, and phlebotomist ID code. A barcode specimen label must include unique patient identifiers, collection date and time, and collector identification. These elements support traceability from bedside collection through laboratory reporting. Insurance information and unrelated personal data do not belong on the tube label. Question 17. Which of the following additives is used to preserve glucose stability by preventing its breakdown by red blood cells? Option A. Sodium citrate. Option B. Sodium fluoride. Option C. Lithium heparin. Option D. Ammonium oxalate. The correct answer is option B. Sodium fluoride. Sodium fluoride preserves glucose by inhibiting glycolysis in blood cells. This slows cellular consumption of glucose after collection. Citrate, heparin, and oxalate alone do not provide the same glycolysis inhibition. Question 18. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 19. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 20. Which of the following steps is part of the proper protocol for performing a newborn screening? PKU. Collection. Option A. Layering multiple drops of blood onto a single filter paper circle. Option B. Touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Option C. Using a capillary tube to collect blood and then smearing it across the card. Option D. Wiping the filter paper card with isopropyl alcohol before applying blood. The correct answer is option B. Touching the filter paper directly to the infant's heel puncture site to absorb blood into the circles. Newborn screening cards should be filled by allowing blood to soak directly from the heel drop into the filter paper circles. The paper should not be pressed hard against the skin or layered repeatedly. Proper saturation through the paper is essential for valid screening. Question 21. What is the clinical purpose of performing a bleeding time test? Option A. To evaluate the integrity of the intrinsic coagulation pathway. Option B. To assess platelet function and the capillary bed's ability to form a primary plug. Option C. To measure the absolute concentration of fibrinogen molecules in plasma. Option D. To screen the body for active systemic bacterial infections. The correct answer is option B. To assess platelet function and the capillary bed's ability to form a primary plug. Bleeding time assesses platelet function and the ability of small vessels to form a primary hemostatic plug. It reflects platelet-vessel interaction rather than the intrinsic or extrinsic coagulation pathways. Coagulation factor problems are better evaluated with tests such as patient or APTT. Question 22. Which of the following conditions is an example of an autoimmune or hematological test commonly drawn in a lavender tube? Option A. Prothrombin time, patient. Option B. Erythrocyte sedimentation rate, ESR. Option C. Basic metabolic panel, BMP. Option D. Blood culture series. The correct answer is option B. Erythrocyte sedimentation rate, ESR. ESR is commonly collected in an EDTA tube because the test evaluates red cell settling in anticoagulated blood. Lavender tubes preserve cellular components and prevent clotting. Coagulation and chemistry tests require different tubes and additives. Question 23. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A. Collecting a lavender top tube for a CBC test. Option B. Submitting an underfilled light blue coagulation tube. Option C. Delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D. Affixing a handwritten label over a pre-printed barcode label. The correct answer is option B. Submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 24. What is the standard depth of a lancet puncture used for a fingerstick on an adult patient? Option of 1.0 to 1.5 mm. Option B 1.8 to 2.4 mm. Option C 3.0 to 4.0 mm. Option D 4.5 to 5.0 mm. The correct answer is option B 1.8 to 2.4 mm. Adult fingerstick lancets generally penetrate about 1.8 to 2.4 mm. This depth reaches the capillary bed while limiting injury to deeper structures. Shallower punctures may not provide adequate flow, and deeper punctures can cause unnecessary trauma. Question 25. Which gauge needle has the smallest lumen diameter? Option A 18 gauge. Option B 21 gauge. Option C 23 gauge. Option D 25 gauge. The correct answer is option D 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 26. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A. Droplet transmission. Option B. Contact transmission. Option C. Airborne transmission. Option D. Vector-borne transmission. The correct answer is option C. Airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 27. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 28. Which of the following options defines the proper site for an adult capillary puncture? Option A, the thumb or index finger of the dominant hand. Option B, the lateral or medial plantar surface of the heel. Option C, the palmar surface of the distal segment of the middle or ring finger. Option D, the side of the pinky finger near the cuticle. The correct answer is option C, the palmar surface of the distal segment of the middle or ring finger. Adult capillary puncture is performed on the palmar surface of the distal segment of the middle or ring finger. These sites provide good blood flow and avoid bone, tendons, and heavily used thumb or index finger surfaces. The pinky and areas near the nail bed are more prone to injury or poor flow. Question 29. What type of hazard does the blue quadrant of the NFPA 704 diamond represent? Option A, flammability hazard. Option B, reactivity hazard. Option C, health hazard. Option D, special or specific hazard. The correct answer is option C, health hazard. The blue quadrant of the NFPA 704 diamond represents health hazard severity. It communicates the potential for harm from exposure to the material. Red indicates flammability, yellow indicates instability, and white is used for special hazards. Question 30. What should a phlebotomist do if a patient begins to have a grand mal seizure during a venipuncture? Option A, hold the needle steady inside the vein to complete the draw. Option B, remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. Option C, place a wooden tongue depressor inside the patient's mouth to protect their tongue. Option D, restrain the patient's arms firmly against the drawer chair to stop all movement. The correct answer is option B, remove the needle and tourniquet immediately, safeguard the patient from injury, and call for medical help. A seizure during venipuncture requires immediate removal of the needle and tourniquet to prevent injury. The patient should be protected from surrounding hazards and medical help should be called. Restraining the patient or placing objects in the mouth can cause harm. Question 31. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 32. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A, gown, gloves, mask, goggles. Option B, gloves, goggles, gown, mask. Option C, mask, gown, goggles, gloves. Option D, goggles, mask, gloves, gown. The correct answer is option B, gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 33. Which of the following tests is part of a routine liver function panel? Option A, creatinine. Option B, alanine aminotransferase, ALT. Option C, hemoglobin A1c. Option D, troponin I. The correct answer is option B, alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 34. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A. Call for an emergency code. Option B. Complete the current tube collection. Option C. Remove the tourniquet and needle immediately. Option D. Place a cold compress on the patient's forehead. The correct answer is option C. Remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 35. Which of the following actions is a violation of proper sharp disposal safety guidelines? Option A. Dropping a needle into the sharps box immediately after withdrawal. Option B. Pushing down on items inside a full sharps container to make extra room. Option C. Disposing of a sharps box when it reaches the indicated full fill line. Option D. Placing the sharps container at eye level near the point of use. The correct answer is option B. Pushing down on items inside a full sharps container to make extra room. Pressing down on a full sharps container can cause puncture injury and aerosol exposure. Sharps containers should be replaced when they reach the marked fill line. They should be located near the point of use and never overfilled or manually compacted. Question 36. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A. Human immunodeficiency virus, HIV. Option B. Hepatitis B virus, HBV. Option C. Tuberculosis, TB. Option D. Malaria. The correct answer is option B. Hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 37. Which of the following is a symptom of nerve injury during a venipuncture? Option A. dull ache in the antecubital fossa. Option B. A sharp, radiating, electric-like pain down the arm. Option C. A sudden feeling of warmth at the puncture site. Option D. Small red spots spreading around the arm. The correct answer is option B. A sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 38. What type of consent is required before a phlebotomist can draw blood from a minor child? Option A. Implied consent from the child's teacher. Option B. Informed or expressed consent from a parent or legally authorized guardian. Option C. No consent is needed as long as a doctor ordered the test. Option D. Verbal consent from the minor patient themselves. The correct answer is option B. Informed or expressed consent from a parent or legally authorized guardian. A minor generally requires consent from a parent or legally authorized guardian before routine blood collection. The child should still receive age-appropriate explanation and cooperation should be sought when possible. A physician order alone does not eliminate consent requirements. Question 39. What is the primary purpose of the multisample needles rubber sleeve? Option A. To cushion the patient's vein from sudden movements. Option B. To prevent blood from leaking into the tube holder adapter between tube changes. Option C. To keep the needle sharp until it enters the vein. Option D. To guide the needle into the exact center of the vacuum tube. The correct answer is option B. To prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 40. Which of the following blood components is responsible for the initiation of the coagulation process? Option A, erythrocytes. Option B, leukocytes. Option C, thrombocytes. Option D, hemoglobin. The correct answer is option C, thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 41. Which of the following is the most critical step in performing any phlebotomy procedure? Option A, choosing the correct size needle. Option B, verifying patient identification. Option C, selecting the appropriate vein. Option D, applying the tourniquet tightly. The correct answer is option B, verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 42. Which of the following is an example of an implied consent scenario? Option A patient signs a formal document for an invasive procedure. Option B, an unconscious emergency room patient requiring urgent diagnostic lab work. Option C, a patient verbally states they agree to the blood test. Option D, a parent signs a waiver for their underage child. The correct answer is option B, an unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 43. What is the function of sodium polyentyl sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 44. What is the function of the thixotropic gel inside an SST or PSD tube? Option A, to accelerate the coagulation cascade. Option B, to form a physical barrier between cells and serum/plasma during centrifugation. Option C, to preserve glucose levels for up to 24 hours. Option D, to chelate calcium and prevent fibrin formation. The correct answer is option B, to form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 45. What type of patient environment requires protective, reverse, isolation protocols? Option A patient with an active, contagious respiratory flu virus. Option B, a patient with an open, draining MRSA wound infection. Option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Option D, a patient with suspected food poisoning or viral gastroenteritis. The correct answer is option C, a patient with a severely compromised immune system, such as a recent bone marrow transplant recipient. Protective or reverse isolation is used for patients with severely weakened immune systems. The goal is to protect the patient from microorganisms carried by staff, visitors, and the environment. Patients with contagious infections generally require standard, contact, droplet, or airborne precautions instead. Question 46. What is the primary clinical consequence of warming an infant's heel prior to a dermal puncture? Option A. It decreases the pain perception of the infant. Option B. It increases localized arterial blood flow up to 7-fold. Option C. It sterilizes the deeper layers of the epidermis. Option D. It prevents the formation of an unneeded hematoma. The correct answer is option B. It increases localized arterial blood flow up to 7-fold. Warming an infant's heel increases local blood flow and improves capillary specimen collection. Better perfusion can reduce squeezing, which helps avoid tissue fluid contamination. Warming does not sterilize tissue or eliminate the need for proper puncture depth. Question 47. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A. Plasma. Option B. Serum. Option C. Whole blood. Option D. Fibrinogen-rich extract. The correct answer is option B. Serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 48. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 49. A specimen for a lactic acid test must be handled using which special accommodation? Option A. Placed immediately on an ice slurry. Option B. Incubated at 37 degrees Celsius until tested. Option C. Kept away from all light sources using foil. Option D. Centrifuged immediately within 5 minutes of draw. The correct answer is option A. Placed immediately on an ice slurry. Lactic acid specimens are commonly chilled promptly to slow cellular metabolism after collection. Continued glycolysis can change lactate concentration if handling is delayed. Light protection or warming is used for different analytes, not routine lactate preservation. Question 50. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 51. How should a phlebotomist approach a child who needs a blood test? Option A. Tell them it will not hurt at all to gain their trust. Option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Option C. Have 3 guards hold them down before introducing yourself. Option D. Show them the largest needle to prove how brave they need to be. The correct answer is option B. Explain the procedure in simple, age-appropriate terms and ask for their cooperation. Children cooperate best when the procedure is explained honestly in language they can understand. Asking for cooperation while using calm reassurance promotes trust and reduces fear. Saying it will not hurt or showing an intimidating needle can increase distress and loss of trust. Question 52. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A. Serum layer. Option B. Buffy coat. Option C. Fibrin web. Option D. Thrombotome. The correct answer is option B. Buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 53. Which of the following statements matches the correct definition of assault? Option A. Unjustified or unconsented physical contact with another person. Option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Option C. Revealing confidential medical findings to unauthorized personnel. Option D. Mislabeling a laboratory specimen tube by accident. The correct answer is option B. The intentional threat or attempt to cause bodily harm, creating fear in the patient. Assault is an intentional threat or attempt that makes a patient fear harmful contact. No physical touching is required for assault to occur. Battery involves unauthorized touching, and confidentiality breaches involve private information rather than threatened harm. Question 54. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A. Phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B. Patient's insurance policy number and diagnosis code. Option C. Phlebotomist's full signature and room number. Option D. Name of the ordering physician and laboratory phone number. The correct answer is option A. Phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 55. Which of the following tubes contains an additive that preserves glucose levels for up to 3 days? Option A. Gray top, sodium fluoride. Option B. Light blue top. Option C. Lavender top. Option D. Green top. The correct answer is option A. Gray top, sodium fluoride. Gray tubes containing sodium fluoride preserve glucose by inhibiting glycolysis for an extended period. This helps maintain glucose concentration when processing may be delayed. Other tube types do not provide the same glucose stabilizing additive. Question 56. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 57. Which of the following statements is true regarding a multisample needle gauge? Option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Option B. An 18-gauge needle is smaller than a 23-gauge needle. Option C. The larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 58. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A. Light blue, blood culture, lavender. Option B. Blood culture, light blue, lavender. Option C. Lavender, light blue, blood culture. Option D. Blood culture, lavender, light blue. The correct answer is option B. Blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 59. What type of fire extinguisher should be used on an electrical fire occurring in a laboratory centrifuge? Option A, Class A. Option B, Class B. Option C, Class C. Option D, Class D. The correct answer is option C, Class C. Class C extinguishers are used for energized electrical equipment. They are designed to suppress fire without conducting electricity back to the user. Water-based Class A extinguishers can be dangerous on electrical fires. Question 60. What type of isolation room requires the air pressure to be lower than the surrounding hallway air pressure? Option A, negative pressure isolation room, airborne precautions. Option B, positive pressure isolation room, protective isolation. Option C, standard contact isolation room. Option D, droplet precaution room. The correct answer is option A, negative pressure isolation room, airborne precautions. Airborne isolation uses negative room pressure so contaminated air flows into the room rather than out to the hallway. This helps contain airborne pathogens such as tuberculosis, measles, or varicella. Protective isolation for immunocompromised patients often uses positive pressure instead. Question 61. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A, directly from the foreline itself. Option B, from the left arm. Option C, above the foresight on the right arm. Option D, from the hand on the right arm. The correct answer is option B, from the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 62. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option A, light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 63. Which of the following options defines the proper site for performing a venipuncture on a patient's hand? Option A, the ventral aspect of the wrist near the radial artery. Option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Option C, the inside aspect of the thumb pathway. Option D, the lateral borders of the palm. The correct answer is option B, the dorsal aspect of the hand, focusing on the dorsal venous network. Hand venipuncture is performed on the dorsal venous network on the back of the hand. These veins are superficial and require careful anchoring and a shallow angle. The palm, wrist, or underside of the hand carries more risk and is not preferred. Question 64. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A, erythrocyte sedimentation rate, ESR. Option B, oral glucose tolerance test, OGTT. Option C, activated partial thromboplastin time, APTT. Option D, blood urea nitrogen, BUN. The correct answer is option B, oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses grey tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 65. What type of protective equipment must be worn when performing a venipuncture on a patient with droplet precautions? Option A, an N95 respirator mask and shoe covers. Option B, a standard surgical mask and gloves. Option C, a full body Tyvek suit and goggles. Option D, no personal protective equipment is required. The correct answer is option B, a standard surgical mask and gloves. Droplet precautions require a surgical mask, and gloves are used for venipuncture under standard precautions. The mask protects mucous membranes from large respiratory droplets during close contact. N95 respirators are reserved for airborne precautions. Question 66. Which of the following is an example of an analytical component of quality assurance? Option A, double-checking patient identity wristbands. Option B, ensuring proper maintenance and calibration of automated laboratory equipment. Option C, delivering critical panic results to a physician on time. Option D, labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 67. What does the term erythema mean? Option A, redness of the skin caused by congestion or inflammation of the capillaries. Option B, a pale appearance of the skin due to low red cell counts. Option C, a bluish tint to the skin caused by a lack of oxygen. Option D, a yellowing of the skin caused by high bilirubin levels. The correct answer is option A, redness of the skin caused by congestion or inflammation of the capillaries. Erythema means redness of the skin from capillary congestion or inflammation. It may be seen with irritation, infection, allergy, or localized trauma. Pallor, cyanosis, and jaundice describe pale, blue, and yellow color changes. Question 68. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 69. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A, draw the blood anyway and ask the patient to state their name. Option B, look for the ID band on the nightstand or 4-pole and scan it. Option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D, verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C, refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 70. Which of the following procedures describes the correct method for transporting an ammonia specimen to the laboratory? Option A, keep the tube warm inside an incubator at 37 degrees Celsius. Option B, place the tube immediately into an ice and water slurry to chill it completely. Option C, wrap the tube tightly in heavy foil to prevent any exposure to room lights. Option D, maintain the tube at a room temperature of exactly 25 degrees Celsius. The correct answer is option B. Place the tube immediately into an ice and water slurry to chill it completely. Ammonia specimens must be chilled promptly in an ice and water slurry and transported quickly. Delayed or warm handling can allow ammonia levels to rise in the specimen. Light protection and warm incubation are used for different tests. Question 71. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, option B 5:1, option C 9:1, option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 72. What should a phlebotomist do if they note a discrepancy between the patient's verbal name and the name on the pre-printed lab requisition? Option A. Change the requisition manually using a pen to match the verbal statement. Option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Option C. Draw the blood and sort out the labeling discrepancy later in the lab. Option D. Assume the patient knows their own name and print a new label on the spot. The correct answer is option B. Contact the supervisor or ordering nurse to resolve the issue before drawing blood. Any mismatch between the patient's statement and the requisition must be resolved before collection. Proceeding with unresolved identity information can create a wrong patient specimen and unsafe results. The phlebotomist should involve the supervisor, nurse, or ordering provider according to policy. Question 73. Which of the following scenarios describes the correct patient preparation for an oral glucose tolerance test, OGTT? Option A. The patient should eat a low-carbohydrate diet for 3 days prior to the test. Option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. Option C. The patient should exercise vigorously right before drinking the glucose solution. Option D. The patient can drink black coffee or tea during the hours of the testing period. The correct answer is option B. The patient must fast for at least 8 to 12 hours before the baseline draw is performed. An OGTT begins with a fasting baseline specimen, usually after 8 to 12 hours without caloric intake. Food, coffee, or strenuous exercise can alter glucose metabolism and invalidate the test. A low-carbohydrate diet before testing can also distort the response to the glucose load. Question 74. Specimen tubes must be labeled at what point during the collection process? Option A. Prior to entering the patient's room. Option B. Immediately after drawing the blood, before leaving the patient's side. Option C. At the central processing lab desk. Option D. After the specimen has finished centrifuging. The correct answer is option B. Immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 75. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A. Hematology. Option B. Microbiology. Option C. Clinical chemistry. Option D. Blood bank. The correct answer is option C. Clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 76. What is the function of platelets, thrombocytes, in the human body? Option A. Transporting carbon dioxide back to the pulmonary system. Option B. Producing specific antibody proteins to neutralize viral particles. Option C. Participating in primary hemostasis by aggregating to form a platelet plug. Option D. Maintaining systemic core body temperature variations. The correct answer is option C. Participating in primary hemostasis by aggregating to form a platelet plug. Platelets support primary hemostasis by adhering to damaged vessel surfaces and aggregating into a platelet plug. They also provide a surface for coagulation reactions that stabilize clot formation. Red cells carry gases, and leukocytes provide immune defense. Question 77. Which of the following elements can cause a falsely elevated calcium level during a venipuncture? Option A, prolonged tourniquet application past 2 minutes. Option B, chilling the specimen on an ice slurry. Option C, using a 21 gauge needle on a large vein. Option D, failing to wipe away the first drop of blood during a finger stick. The correct answer is option A, prolonged tourniquet application past 2 minutes. Prolonged tourniquet application can concentrate proteins and protein-bound analytes, including calcium. This may create falsely elevated calcium results. Chilling, normal needle size, or capillary first drop handling do not cause the same venous stasis effect. Question 78. What should a phlebotomist do when a multisample vacuum tube fails to fill with blood during a draw? Option A, gently advance or pull back the needle slightly to ensure it is in the lumen. Option B, remove the needle completely and start over on the other arm. Option C, leave the tube in place for 3 minutes to allow the vacuum to recover. Option D, push the needle deeper at a 90-degree angle. The correct answer is option A, gently advance or pull back the needle slightly to ensure it is in the lumen. A vacuum tube that fails to fill may indicate the needle bevel is against the vein wall or not fully in the lumen. A small adjustment forward or backward can restore flow without unnecessary reinsertion. Pushing deeply or waiting for the vacuum to recover can injure tissue and waste time. Question 79. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, it is located near the brachial artery and median nerve. Option C, it has a high tendency to collapse under low pressure. Option D, it contains valves that prevent blood flow into the tube. The correct answer is option B, it is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 80. What is the correct order of draw when collecting a blood culture, a chemistry SSD, and a sodium citrate tube using a multisample needle system? Option A, SST, light blue, blood culture. Option B, blood culture, light blue, SST. Option C, light blue, SST, blood culture. Option D, blood culture, SST, light blue. The correct answer is option B, blood culture, light blue, SST. Blood cultures are drawn first, followed by light blue citrate tubes and then serum tubes such as SST. This sequence protects culture sterility and reduces additive carryover into coagulation specimens. Drawing SST before citrate can introduce clot activator or gel-related contamination risk. Question 81. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A, 2 to 4 hours. Option B, 4 to 6 hours. Option C, 8 to 12 hours. Option D, 18 to 24 hours. The correct answer is option C, 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 82. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A, lactic acid and ammonia. Option B, cold agglutinins and cryoglobulins. Option C, bilirubin and vitamin B6. Option D, prothrombin time, patient. The correct answer is option A, lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 83. What is the proper location for a capillary puncture on an infant's foot? Option A, the center of the plantar surface near the arch. Option B, the medial or lateral borders of the plantar surface of the heel. Option C, the tip of the great toe. Option D, the posterior curvature of the heel bone. The correct answer is option B, the medial or lateral borders of the plantar surface of the heel. Infant heel punctures are performed on the medial or lateral borders of the plantar heel. These areas avoid the calcaneus and reduce the chance of bone injury. The arch, great toe, and posterior heel are unsafe sites for routine infant skin puncture. Question 84. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A, protecting the syringe from exposure to direct light sources. Option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C, inverting the syringe 20 times to mix the clot activator. Option D, using a gray top tube to transport the arterial blood. The correct answer is option B, ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 85. Which of the following represents an occupational exposure route for a blood-borne pathogen? Option A, blood splashing into a phlebotomist's eyes. Option B, touching an intact skin surface with clean hands. Option C, inhaling air in a well-ventilated laboratory room. Option D, spilling saline solution onto a lab bench. The correct answer is option A, blood splashing into a phlebotomist's eyes. Blood splashing into the eyes is an occupational exposure because mucous membranes can transmit blood-borne pathogens. Eye protection is used when splash risk exists to prevent this route of exposure. Contact with intact skin or clean surfaces does not carry the same exposure risk. Question 86. What does the term basal state refer to in clinical laboratory testing? Option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B, the physical state of the body directly following a heavy workout session. Option C, the point of highest metabolic activity in the afternoon. Option D, the body's state while under heavy psychological stress. The correct answer is option A, the condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 87. Which of the following can lead to a rejected specimen due to short draw? Option A, inverting a lavender tube 8 times. Option B, underfilling a light blue coagulation tube. Option C, using a 21-gauge needle on a large vein. Option D, drawing a serum separator tube before a green tube. The correct answer is option B, underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 88. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A, polycythemia. Option B, anemia. Option C, leukemia. Option D, leukopenia. The correct answer is option B, anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 89. Which tube is typically utilized to collect samples for blood bank cross-matching and typing? Option A, pink top, EDTA, or plain red top. Option B, light blue top, sodium citrate. Option C, gray top, sodium fluoride. Option D, green top, sodium heparin. The correct answer is option A, pink top, EDTA, or plain red top. Blood bank typing and cross-matching commonly use EDTA pink top tubes or plain red top tubes depending on facility requirements. EDTA preserves red cell antigens and prevents clotting for many immunohematology procedures. Citrate, fluoride, and heparin tubes are used for other testing categories. Question 90. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 91. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 92. What is the major drawback of using a needle with a gauge size of 25 or higher for venipuncture? Option A. It causes severe tissue tearing upon skin entry. Option B. It carries an extremely high risk of causing hemolysis in the sample. Option C. It penetrates too deeply into the basilic structures. Option D. Vacuum tubes will lose their suction pressure entirely. The correct answer is option B. It carries an extremely high risk of causing hemolysis in the sample. Very small needles, such as 25 gauge or higher, can damage red cells as blood is forced through a narrow lumen. This increases hemolysis risk and may compromise chemistry results. Larger needles are not always appropriate, but extremely small gauges are avoided for routine venipuncture. Question 93. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A, serum. Option B, plasma. Option C, whole blood. Option D, fibrin clot. The correct answer is option B, plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 94. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 95. What is the standard duration for an administrative scrub or hand washing when preparing for routine patient contact? Option A, 5 seconds. Option B, 20 seconds. Option C, 1 minute. Option D, 3 minutes. The correct answer is option B, 20 seconds. Routine hand washing before patient contact should last at least 20 seconds. This duration allows adequate friction and contact time to remove transient microorganisms. Very brief washing is ineffective, while surgical scrub times are reserved for different procedures. Question 96. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 97. Which antiseptic is recommended for a patient undergoing a skin puncture for a blood culture if they are allergic to chlorhexidine? Option A, 70% ethyl alcohol. Option B, povidone. Option C, hydrogen peroxide. Option D, benzalkonium chloride. The correct answer is option B, povidone. Povidone is an appropriate alternative when chlorhexidine cannot be used for blood culture skin preparation. It provides broad antimicrobial activity when applied and allowed to dry according to protocol. Hydrogen peroxide and benzalkonium chloride are not standard substitutes for this purpose. Question 98. Which of the following elements is a key component of quality control in a point-of-care testing (POCT) program? Option A, documenting the daily temperature of the laboratory refrigerator. Option B, verifying that the patient's insurance information is updated. Option C, running electronic or liquid controls according to manufacturer and facility guidelines. Option D, cleaning the outpatient waiting room chairs with bleach solution. The correct answer is option C, running electronic or liquid controls according to manufacturer and facility guidelines. POCT quality control includes running electronic or liquid controls according to manufacturer instructions and facility policy. Controls verify that the device, reagents, and operator process are producing reliable results. Patient testing without required QC can lead to inaccurate bedside decisions. Question 99. What type of glove material should be used if a patient or phlebotomist has a documented type I hypersensitivity allergic reaction? Option A, powdered latex. Option B, non-powdered latex. Option C, nitrile or vinyl. Option D, cotton utility gloves. The correct answer is option C, nitrile or vinyl. Type I latex hypersensitivity can cause serious allergic reactions, so latex gloves should be avoided. Nitrile or vinyl gloves provide barrier protection without latex protein exposure. Cotton gloves do not provide adequate protection for blood collection. Question 100. What is the modern medical term for a condition characterized by an abnormally low white blood cell count? Option A, leukocytosis. Option B, leukopenיה. Option C, thrombocytopenia. Option D, polycythemia. The correct answer is option B, leukopenיה. Leukopenia means an abnormally low white blood cell count. It may indicate marrow suppression, infection effects, medication effects, or immune compromise depending on context. Leukocytosis is high white blood cells, while thrombocytopenia and polycythemia refer to platelets and red cell mass.